The Flexhaler is a dry powder inhaler, or DPI, that contains multiple doses of medication within this case. Before using the Flexhaler for the first time, you must prime the inhaler once. To prime it, hold the bottom of the device. Remove the cap covering the mouthpiece by twisting it counterclockwise and lifting the cap up and set it aside. Then hold the inhaler in the middle of the white part, not near the mouthpiece. Turn the bottom end of the inhaler all the way in one direction and then all the way in the other direction, making sure you hear a click like this. Priming only has to be done once, and now your Flexhaler is ready to be used. When you're ready to take your dose of medicine, hold the Flexhaler upright with your hand at the base and remove the cap as explained before so that you can see the mouthpiece and the counter. Before you get ready to take the medicine each time, make sure the counter shows available doses. Of note, the indicator counts down by 20s. Hold the inhaler in the middle of the white part with one hand and load the medication by using the other hand to turn the bottom end of the inhaler all the way in one direction and then all the way in the other direction, making sure you hear the click, like this. This click means the dose is loaded and ready to be inhaled. Now never shake the device because the fine dry powder may spill out. If you accidentally drop it after loading the dose, then you must start over because the powder likely spilled. Holding the Flexhaler away from your mouth, breathe out gently but completely. Never exhale into the Flexhaler because you may blow out the powder. After exhaling away from the device, hold the inhaler horizontally or parallel to the floor. Seal your lips around the mouthpiece. Do not use a spacer with the Flexhaler. Take in a forceful deep breath through your mouth until you can't breathe in anymore, just like this. Move the device away from your mouth. Although the package insert does not mention a breath hold, it would be reasonable to be consistent with other inhalers for you to hold your breath for up to 10 seconds or as long as possible. Then slowly breathe out. If a second dose is prescribed, load another dose of medication by twisting the base in one direction and then in the other, making sure you hear the click. Then repeat the steps above to inhale the medication deep into your lungs. Close the inhaler by twisting the cap clockwise to the right as you gently press the cap down over the mouthpiece. Because the Flexhaler contains an inhaled corticosteroid, after inhaling the prescribed doses, rinse your mouth, gargle, and spit. Do not swallow to reduce the risk of a fungal infection in the mouth called thrush.